Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Welcome back to today's episode. I'm so excited to be joined by Dr. Susan Zink today. Dr. Zink is a board certified psychiatrist practicing in the Linwood, New Jersey area. She has her own private practice there. She sees patients both in clinic, there in person, and does some virtual medicine as well. And we are going to talk about a really important topic today. We're going to talk all about mood and sleep changes that women face around the time of hormone shifts. So, Dr. Zink, welcome to the show, Headed to Healthier. It's so great to have you. I didn't do the best job of introducing you. If you take a few minutes to introduce yourself to my incredible audience, and then let's get right into talking about today's topic.
Thank you so much for having me. So, like you said, I'm Dr. Zink. I'm Dr. Susan Zink. I'm a board certified adult psychiatrist. Have been in practice for over 16 years at this point and have always had an interest in women's mental health. And I did some specialty training in my residency doing reproductive psychiatry, women's mental health, and my practice here now focuses on helping women in the reproductive age with depression, anxiety, sleep issues, irritability, mood changes, and especially those mood changes that can happen during the hormonal shifts during pregnancy, postpartum, perimenopause. So, thank you for having me. I'm excited to talk about that with you today.
Absolutely. In my own family medicine practice, so much of what I speak with ladies in their 40s, 50s, and even further are those mood changes and shifts that are happening. And I realize that they're happening around the time of hormone changes. Even women who
Right.
are pregnant or immediately postpartum, we see those. And so I love that you have special focus there, and we are going to dig into your expertise. So if it's okay,
Sounds good.
we good to get right into it?
Let's do it.
All right, let's do it. So, sleep struggles. So that's one of the things we've had a previous episode all about sleep, but not sleep specifically related to menopause and kind of this perimenopause change and the hormone shifts. I know that in your own practice, you deal a lot with women who have issues with sleep, which certainly can turn into issues with mood. Can you walk us through a little bit of what's happening in the body and in the brain that makes sleep harder at this stage of life, and then how that can affect women's moods during this time?
Yes, absolutely. It's such a good question. It's such an important question. Obviously, half of our population is women, so this is something that most of us will go through in perimenopause. So first of all, I think just defining what is perimenopause, what is menopause. So menopause is that period, the year after the last period. Everything after that last year is postmenopause, and then perimenopause or the transition to menopause can happen in the 7 to 10 years before menopause. So this is actually a pretty long period in many women's lives, with average age of menopause in the late 40s, early 50s, and then perimenopause starting, in the late 30s, early to mid 40s. And so there's so much happening biologically during that time. We see a lot of reproductive hormone changes, reproductive hormones mostly being estrogen, progesterone, testosterone, and then changes also in hormones like melatonin. So as we age, one of the things that happens is the pineal gland in the brain starts to calcify, and that's the gland that secretes melatonin. So we see decreases in melatonin related to that, but also estrogen, progesterone are involved in the production and secretion of melatonin. And so when those hormone levels start to drop, that also leads to a drop in melatonin. So we get kind of a double hit. And melatonin is that hormone that tells our bodies when to go to sleep and stay asleep. And so we have some sleep disruption from just that drop in melatonin, for one thing. And then we get these kind of wild fluctuations in the estrogen and progesterone levels that normally are pretty regular during the premenopausal stage. So we have our normal menstrual cycles, and we have most often kind of a predictable rise and fall in estrogen and progesterone in that period. But then in perimenopause, things are just kind of all out of whack. And so eventually these hormone levels start to drop, and estrogen and progesterone are really protective of sleep. And so when the levels start to drop, that can really affect sleep for a lot of different reasons. The other really important thing to consider is that the hot flashes and the night sweats themselves can be disruptive of sleep, but that's not the only thing that disrupts sleep in perimenopause. There's a huge increased risk of sleep apnea in perimenopause, restless leg syndrome. So, something like 50% of women in perimenopause and postmenopause will have sleep apnea. And then there are a whole host, dozens of different sleep disorders that can also occur. So, all of these things together are happening in the brain and the body and can really lead to a lot of sleep disruption in this stage of life.
Right. And then that sleep disruption, assuming, is what leads to kind of some of the things that you see even more of in your practice as well. So it's one thing to not be sleeping well because you're having hot flashes and all those, but it's a whole other shift when you're not sleeping well and that starts to affect your mood. Right. And so would you
Absolutely.
chat a little bit just about what that looks like? So kind of the real implications of not getting the sleep that your body needs nightly.
Sleep is so important for everything. So, sleep is when our bodies and our brains are repaired and restored. And so, when we have poor sleep quality, when we're not getting enough sleep or sleep is disrupted, that can affect really everything about our health, but especially also mood and anxiety. And so, we know that disrupted sleep can lead to depression and anxiety, or worsening in a pre-existing depression or anxiety. I mean, I'm sure if you think about it, when you get just one poor night of sleep, everyone feels kind of more irritable and tired and
Yeah.
snappy. And so then when you compound it by many, every night or multiple nights, for weeks or months or years of poor sleep, that can really have quite an effect on your mood and your anxiety levels long term. So the sleep disruption itself can really exacerbate any problem, but then of course all these hormonal mood shifts themselves can lead to poorer mood and more anxiety because of how the estrogen and the progesterone are involved in the synthesis of these neurotransmitters that we think are involved in maintaining um, a feeling of wellness. There are a lot of there are a lot of factors that can go into the mood and the anxiety issues that occur around the stage of life, coupled with the fact that um, if you look at the psychosocial stressors that are occurring often during this stage of life for women, including kind of like usually um, a sort of advanced stage in their career where they're focusing a lot on work and career, and they may be taking care of children and aging adults, and usually children who are involved in some activities, or they're getting kind of
Uh-huh.
intense at school, or maybe they're doing college visits, and then taking care of aging parents and also the career, and now you're not sleeping well. And so all of these things can really combine together to affect the mood as well.
Right. I feel like our 40s and 50s are like this perfect storm of all of the things that come together. We're having the hormone changes. Like you said, life is lifing for most of us during that time as well, whether it's us with, busy careers, or those of us who are caring for children or our aging parents. And so many things kind of compound at once. What's your advice to patients around this time? Or, just very general. We're not giving any specific medical
Right.
advice or anything like that. But in general, how do you begin to approach with your patients how to address some of these major changes that are happening in our lives around this time?
Right. First of all, I think it's really important to send the message to women that they can't pour from an empty cup. So you have to take care of yourself first before you're taking care of anybody else. If you have no reserve, it's really hard to do anything for anybody. So sometimes it's helpful just to give a woman permission to take care of herself, to remind her that it's not selfish, and that can look like a lot of different things, but that's number one.
When you see mood changes and those things that you see in your practice that you really feel like and strongly believe due to those hormonal shifts, is this a time that the hormones themselves need to be addressed, or is this something that women should expect to, give a little bit of time, especially when we think about like that postpartum period? At what point would you say, all right, this has become a problem? Or at what point do women usually come in and say, all right, this is a problem. What is my next step?
Such a good question. First of all, I think anytime a woman wonders whether she needs help, then she should just ask, right? So reach out for help. Even if you're not sure, I would say if you think you might need help and you're not sure, there's a good chance that you probably do. But even everyone needs help
Mhm.
anytime in their lives, right? So I think there's no harm in reaching out for help. And that might be, if you're newly postpartum, that might be your child's pediatrician or a lactation support person, your primary care doctor, your gynecologist. Certainly, if you already have a therapist or psychiatrist, you want to let them know if there's something that's changing, but you can also always reach out to a new therapist or psychiatrist if you don't have one already. I also like to distinguish between things that are normal and things that are common. And so just because something is common doesn't mean that it's normal. So postpartum depression is very common. It's maybe 15% of the population. In perimenopause, we see mood changes in probably about a third of women, sleep disruption in at least half. So while it's common, it's not necessarily normal. And that doesn't mean that, it's just something to be endured. And there are a lot of different treatment options that are available for all of these things.
Right. And I love the point that you make. I think so often, especially as women, we get in groups with friends or we talk to our moms or aunts about these things. And
Social media.
it's social media, exactly. And you start to believe that there's so many people who are experiencing this and are quote unquote pushing through it or just writing it out or enduring, as to use the term that you did. And it's not necessary, right? It's not
Right.
always necessary to have to just tough it out. There's no prize at the end of our life for pushing through, enduring things that
Right.
we have options for treatments for. Would you agree, or do you have anything?
Absolutely. Yes, absolutely. There's no prize for suffering.
I love that. That's a better way to put it. There's no prize for suffering at all.
That's
So,
right.
yeah, let's talk a little bit more about the anxiety, irritability, and maybe even some of the depression that women may see
Hmm.
around the times of hormonal shifts. You've already talked about kind of the role of hormone shifts here and a little bit about how we notice the difference between normal changes, whatever normal is, and
Right.
abnormal. Can you chat just a little bit more about that? At what point would you say to me as a primary care doc or to a patient, this is the place where you need to be seeing psychiatry. You need to be seeing someone like Dr. Zink, who has a special focus on, those mood changes during hormonal shifts.
So I think if something is not happening very frequently, or if it's not really bothering you that much, then that's something that may not need a lot of intensive treatment, may need just a little extra support. But if there's something that's very bothersome, or it's happening persistently, or um, most days of the week, or it's been going on for weeks or months or years, that's where I would consider, first of all, consider seeking some higher level treatment. And then, of course, if it's affecting your functioning. So, if you are not doing as well at work, or your relationships are suffering, or if you're just miserable, I would suggest you would seek out some kind of treatment. Of course, if you have more severe symptoms like hopelessness, or if you're feeling like you're giving up on life, or you want to give up on life, or certainly if you're having any suicidal thoughts, that would be very, very urgent. Definitely, if you're having any of those kinds of symptoms, then you would want to reach out for help.
Right, absolutely. We brought up earlier medications. You mentioned melatonin. I tell my patients melatonin you can get over the counter, right? My
Right.
patients are probably with you if you ask them what a pineal gland is. They actually know it because I spend so much time talking to them about their pineal gland and production of melatonin. So it's so funny that you said that to any of my patients who are listening. It's not just me. Dr. Zink said the same.
Yeah.
and I
There you
love
go.
it. And so there are sometimes some over-the-counter things that people can do. We think about melatonin. We do sometimes get into this fuzzy area, especially as it relates to sleep, though, that, I'll tell my patients if you're having to take something over the counter, not like melatonin, which is just really reset your sleep cycle, but if you're having to take Benadryl every night, we need to take a step back and look at this from a different standpoint. I'm going to ask you to maybe be my amen corner on that one as it relates to sleep.
Yes, amen.
Yes. And in addition to medications, because there are those that, again, are over the counter, there are medications that can be prescribed, whether that is hormone replacement or, medications that are specifically for mood changes or mood disorders. But I believe that there are also some lifestyle or behavioral strategies that can really make a difference in improving our sleep and stabilizing our mood. Would you talk about that a little bit? And I think what you're probably going to do also is make that distinction at saying "Okay, there are things that, yes, lifestyle changes and
Mhm.
you do every day behaviorally will change, but there also is a place for medicines.
Yes. Yeah, absolutely. And I think so first of all, and I will definitely talk about lifestyle and other behavioral interventions, but I think first of all, it's really important to, before we're treating the sleep problem, diagnosing what's causing it.
Yeah.
So it may be just that it's a hormonal change because of perimenopause, but it also could be sleep apnea or restless leg syndrome or depression or anxiety or one of the other host of sleep disorders. And so, if we know what we're treating, then we know how to treat it much more clearly. So, in terms of the lifestyle changes that are really important, of course, exercise, any kind of movement, even going on a walk most days of the week, getting outside and getting that bright light in the morning, walking outside can be really, really helpful for setting the circadian rhythm and just exercise in general. And it doesn't have to be intense exercise, it can just be some movement that really makes you feel good. Walking, yoga, weightlifting, which gets important,
Yes.
especially as we age. And then, of course, nutrition. So, eating a diet rich in fiber, protein, foods that have magnesium, vitamin D, iron, that can be very important. And that's largely because a lot of those minerals and nutrients are involved in the synthesis of neurotransmitters that help with mood and sleep. And then maintaining good gut health and eating probiotics, all of those things have evidence to help also with mood and anxiety and sleep and keeping a healthy brain. Getting bright light in the morning can be very helpful. So if you're lucky enough to live in a place where there's a lot of natural bright sunlight, then getting out in the morning for a walk can be a good thing to do. Sometimes I recommend a light box to my patients. So if you live in a northeastern climate like I do, or a darker climate where there's not a lot of light in the winter, then you can get a light box, which is just what it sounds like. It's just a device that emits light, and usually you want a 10,000 lux strength and 30 minutes in the morning. Typically, I recommend you put it on your bathroom counter while you're getting ready in the morning and just get that bright light in your eyes. And then, of course, there's sleep hygiene too, right? So you have to having a good sleep routine before you go to bed is really important. Sleeping in a cool, dark, comfortable place where it's quiet. If you need a sleep mask to block out light or earplugs to block out noise, that can be very helpful.
So if someone is listening to this, maybe they're out on their morning walk, getting that early sunlight in, or driving to work or doing any other number of things. But if someone's listening, thinking, this is me, Dr. Zink and Dr. Anderson are talking about me. I having the sleep changes, I'm having the mood changes, my family is seeing these mood changes that are coming, or I'm just not
Mhm.
able to do the things that I need to do, or the things that I once found pleasurable to do. I'm not finding that joy or excitement in those things. What would you say is the first practical step that she should take today to start improving her sleep and emotional well-being?
The first probably practical step may be to call whatever doctor you have to reach out and to make an appointment. Um, and also there are so many things. I mean, we've talked about so many things, and that can feel really overwhelming. So you can kind of think of it like a menu, like here are all the options that you have, and whichever one sounds like it's kind of the low-hanging fruit, then reach for that one and try that one first. And you don't have to do this all at once, but certainly reaching out to your doctor or your therapist if you already have one, so that you can really get a thorough evaluation and assessment and a solid treatment plan so that you can feel better.
You covered a lot, but things, I mean, I learned, I was taking notes over here as you were talking. I learned so much. So, ladies, this may be one that you come back to over and over and over again. And just like Dr. Zink said, you choose from that menu. All right, I'm going to focus on, this little bit for a period of time, and then I'm going to add this to it and add this to it because there are so many options that are out there to get to a better space, to get to a healthier space. I love that you brought up that first kind of most practical step is to get in touch with your primary care physician. To if you already have a therapist, get in touch with them and let's talk through these things. Again, I think
Right.
the overarching theme for this episode is that there's no prize for struggling through, right? And that there are, medical professionals who are here and who are willing to help. Dr. Zink, thank you so much for your time today. You dropped so many wonderful pearls here. My listeners may be wondering where they can find you. Where else, whether it's on social media or other platforms that you have, can they find you? Now, if you're out and busy and just listening as you do other things or don't have pen and paper near you or can't put it in your phone, don't worry. I'm going to link everything she says after this in the show notes so that you can find Dr. Zink. But tell us where you are and tell us a little bit about your practice. And if folks are in the Linwood, New Jersey area and looking for an incredible and compassionate psychiatrist who has this special focus on hormonal changes, how they can find you.
Yes, thank you. So my website is the name of my practice is Elemental Integrative Psychiatry, and my website is elementalintegrativepsych.com. My email address, all my information is on the website, but the email address is Dr. Zink, DRZ as in zebra, INK at elementalintegrativepsych.com. And I'm on Instagram under Elemental Integrative Psych. Facebook is Elemental Integrative Psychiatry. So please feel free to reach out if you're in the New Jersey area. And actually, I'll be opening up to telehealth in Florida pretty soon too. But
Oh,
yeah, if you're interested in a consultation to see if my practice is the right fit for you, please go to my website or email me and reach out and we can set up a phone call.
that sounds wonderful. Dr. Singh, thanks for sharing that. Like I said, I'll be sure to tag all of your info in the show notes. Y'all go follow her over on social media because just as she dropped so many pearls here today, I'm certain that she does the same on her social media accounts as well. Dr. Zink, any closing words from you?
Thank you so much for having me, and I really hope that this helps a lot of women and they know where to start now if they're struggling with a lot of these symptoms.
Absolutely wonderful to have you. Thank you so much. Ladies, I'll be here next week with another episode. Talk soon. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.